the point of view of medical practice, we are dealing with a new step for in KHS and electrohypersensitivity and multiple chemical sensitivity characterization. That is very important because now we have objective markers, biomarkers, that can be routinely tested through routine tests. So now it's a different situation. Since the last four years, I personally examined clinically and investigated biologically 1,216 patients, which were referred as so-called electrohypersensitivity. On this, about 10% were not associated with electrohypersensitivity based on clinical examination and biological investigation. However, 90% of the people were truly electrohypersensitive patients. Why? Because we had 3 clinical criteria that I will report, and because we had biological anomalies in the blood and in the urine of these patients. So these are really a very important step now because, for example, 40 of these patients with electrohypersensitivity are associated with hyperhistaminemia in the blood. So, and 50% were associated with autoimmune response. These are really objective criteria. And all the patients were associated with some alteration in the brain, and specifically in the area which corresponds to the limbic system and to the thalamus, which are 2 very important areas in the brain. In this area, we were able to show some hypoperfusion, blood hypoperfusion. So we are now critically engaged in these new steps, not only for the diagnosing of these patients, for the diagnosis of this patient, but also for the understanding of the disease. And what is very very important also is to consider that multiple chemical sensitivity and electrohypersensitivity are probably the two aspects of the same disorder, because we had exactly the same type of abnormalities in the blood and the same abnormalities, in the brain. So now we are in a new step in my opinion that can really make this disorder objectively detectable. So I would like to just to sum up before closing this press conference, and you could ask further questions after that. I just want to and before that, Professor Janus Willing will make the conclusion. I just would like to recall you the objectives of this conference. First, sum up the present scientific knowledge regarding electrohypersensitivity and multiple chemical sensitivity. This is what has been done this morning. This is what will be done this afternoon. Second, create a strategic group for electrohypersensitivity and multiple chemical sensitivity to be recognized by international institutions, including WHO and United Nations. This is very important. Now we have sufficient scientific knowledge to avoid the present scientific denial in recognizing these disorders, and to fulfill the gap between our present scientific knowledge and the preventive measures which are not still taken by, the government and the general institutional authorities. And finally, in addition to the International Declaration on the Health Effects of Electromagnetic Fields in general, that is what Magda Havas said this morning. In addition to that, to make a specific declaration focused on electrohypersensitivity and multiple chemical sensitivity towards international institutions and especially WHO, for these disorders be recognized. This is what we would like to do, I guess, and this conference is maybe, as I said, a starting point now to be stronger as far as the policy is concerned. Scientific knowledge is sure there are some areas which are still doubtful, but globally there are some scientific evidence now to propose a clear understanding of the disease and markers for diagnosis.